1. For a patient with pancreatic cancer, which of the following lab values would be most crucial to keep an eye on? A. Serum glucose. B. Radioimmunoassay. C. Phosphokinase of creatine. D. Carcinoembryonic antigen. The answer is A. Serum glucose. 2. When a patient has liver cancer, Nurse Amy noticed changes in their mood, irritability, restlessness, and diminished attention. Neomycin prescribed for the patient has hepatic encephalopathy. Which of the following details from the patient's past would make this order inappropriate? A. Left nephrectomy. B. Both eyes having glaucoma. C. Infarction of the heart. D. Peripheral neuropathy. The answer is A. Left nephrectomy. 3. A nurse intervention for a hepatitis B patient would entail which of the following isolation methods? A. Universal precautions. B. Blood transfusions. C. Enteric separation. D. Strict isolation. The answer is A. Universal precautions. 4. Which stoma would produce a malodorous, enzyme-rich, caustic liquid that is yellow, green, or brown? A. Ileostomy. B. Ascending colostomy. C. Transverse colostomy. D. Descending colostomy. The answer is A. Ileostomy. 5. Patient has a retractable peptic ulcer and has undergone a gastric vagotomy. Which factor increases due to vagotomy? A. Gastric pH. B. Gastric acidity. C. Gastric motility. D. Peristalsis. The answer is A. Gastric pH. 6. The patient underwent a partial gastrectomy for stomach adenocarcinoma. An NG tube is in place and connected to a low continuous suction. What color do you expect gastric secretions to be in the immediate postoperative period? A. Brown. B. Clear. C. Red. D. Yellow. The answer is C. Red. 7. Patient Johann is of 40 years with a suspected case of hepatitis B. He reports weakness and is jaundiced. In your care, which treatment should you use? A. Frequent physical activity. B. A diet low in protein. C. Let the patient choose his own food. D. A period of rest following frequent, small meals. The answer is D. A period of rest following frequent, small meals. 8. You are educating Janine about colostomy care as she is being discharged from the hospital with a colostomy. Which of the following best defines a healthy stoma? A. The stoma may initially bleed a little when touched. B. The stoma should have a bluish color and appear dark. C. It's normal to feel a burning sensation beneath the stoma faceplate. D. The stoma should continue to swell out of the abdomen. The answer is A. The stoma may initially bleed a little when touched. 9. Due to delayed wound healing, a patient who had abdominal surgery now has a gaping incision. Which technique is appropriate when using a piston syringe to irrigate a wide abdominal incision with sterile normal saline solution? A. Quickly inject the wound with a stream of irrigating solution. B. Following irrigation, cover the wound with a wet to dry dressing. C. Following irrigation, moisten the surrounding tissue with regular saline solution. D. Continue to irrigate until the solution clears up or is completely used. The answer is D. Continue to irrigate until the solution clears up or is completely used. 10. Which substance causes an increase in blood levels to cause hepatic encephalopathy? A. Ammonia. B. Amylase. C. Calcium. D. Potassium. The answer is A. Ammonia. 11. Dark, tarry stools indicate bleeding in which location of the GI tract? A. Upper colon. B. Lower colon. C. Upper GI tract. D. Small intestine. The answer is C. Upper GI tract. 12. A patient experiences an acute upper gastrointestinal hemorrhage. Your interventions include A. Dealing with hypovolemia. B. Treating hypervolemia. C. Containing the bleeding source. D. Treating shock and determining the source of the bleeding. The answer is A. Dealing with hypovolemia. 13. When a patient has upper gastrointestinal bleeding, you help them maintain hemodynamic stability by A. Promoting oral fluid consumption. B. Central venous pressure monitoring. C. Tracking vital signs and laboratory test results. D. Resupplying fluids, electrolytes, and blood. The answer is D. Resupplying fluids, electrolytes, and blood. 14. The patient alkunese symptoms include fever, nausea, rebound tenderness, acute abdomen pain that gets worsened with movement and decreased urine production. She has been diagnosed with ulcerative colitis. Which complication might this indicate? A. Fistula. B. Perforation of the bowel. C. Obstruction of the bowel. D. Abscess. The answer is B. Perforation of the bowel. 15. Shervin, a patient, is experiencing a severe worsening of ulcerative colitis. Possible long-term medications could involve A. Corticosteroids. B. Antibiotics. C. Antacids. D. Histamine 2 receptor blockers. The answer is A. Corticosteroids. 16. Patient Anthony diagnosed with peritonitis is currently NPO and expressing feelings of thirst. What should be your primary concern? A. Increase the intravenous infusion rate. B. Implement diversionary activities. C. Administer regular oral care. D. Offer ice chips every 15 minutes. The answer is C. Administer regular oral care. 17. Cherries is undergoing enteral feeding that necessitates a mixture of 80 milliliters of supplement combined with 20 milliliters of water. What is the amount of water to be mixed with an 8 ounces, 240 milliliters, can of feeding? A. 60 milliliters. B. 70 milliliters. C. 80 milliliters. D. 90 milliliters. The answer is A. 60 milliliters. 18. George has a T-tube inserted following his gallbladder surgery. Prior to his discharge, what information or guidance should be provided concerning the T-tube drainage? A. In the event of any drainage, contact the surgeon without delay. B. The amount of drainage is expected to diminish each day as the bile duct heals. C. Initially, the drainage will appear dark green, transitioning to dark yellow over time. D. Should the drainage cease, gently milk the tube towards the puncture site. The answer is B. The amount of drainage is expected to diminish each day as the bile duct heals. 19. Patient Paulana has a medical history of peptic ulcer disease and presents with coffee ground emesis. What does this suggest? A. He is experiencing fresh, active upper gastrointestinal bleeding. B. He requires immediate saline gastric lavage. C. His gastric bleeding took place 2 hours prior. D. He needs a transfusion of packed red blood cells. The answer is C. His gastric bleeding took place 2 hours prior. 20. The student nurse is providing education to the family of a patient diagnosed with liver failure. You advise them to restrict which types of food in the patient's dietary regimen? A. Meats and legumes. B. Butter and sauces. C. Potatoes and noodles. D. Cakes and desserts. The answer is A. Meats and legumes. 21. Histamine 2 receptor antagonists. A. Compete with histamine for attachment points on the parietal cells. B. Form irreversible bonds with H+/K+ ADPase. C. Result in a reduction of stomach pH. D. Alleviate the manifestations and symptoms of allergies associated with histamine release. The answer is A. Compete with histamine for attachment points on the parietal cells. 22. Side effects of loperamide, Imodium, include all of the following except A. Diarrhea. B. Epigastric pain. C. Dry mouth. D. Anorexia. The answer is A. Diarrhea. 23. The mode of action of diphenoxylate is characterized by the following. A. An enhancement of water excretion in the intestines. B. An elevation in intestinal motility. C. A reduction in peristaltic movement within the intestinal wall. D. A decrease in the absorption of water within the bowel. The answer is C. A reduction in peristaltic movement within the intestinal wall. 24. A patient diagnosed with a peptic ulcer is set to undergo a vagotomy. Inquiring about the rationale behind the surgical intervention, the patient poses a question to the nurse. The nurse explains that the purpose of the procedure is to A. Diminish the absorption of food in the stomach. B. Promote healing of the gastric mucosa. C. Interrupt stress responses. D. Lower the stimulation of acid secretion. The answer is D. Lower the stimulation of acid secretion. 25. The nurse will evaluate the patient undergoing an acute episode of cholecystitis for pain that is situated in the right A. Upper quadrant and extends to the left scapula and shoulder. B. Upper quadrant and extends to the right scapula and shoulder. C. Lower quadrant and extends to the umbilicus. D. Lower quadrant and extends to the back. The answer is B. Upper quadrant and extends to the right scapula and shoulder.